Medical services have been affected yet again, and this time in Tamil Nadu. More than 3,000 contractual government nurses have entered the second day of their protest and strike from work. And this is not just in Chennai, across the state of Tamil Nadu. Nurses there demanding permanent jobs, better salaries from the health department officials in the state government. Medical services in the government hospitals, especially in the primary rural healthcare centres, have been hit. The State Health Secretary is likely to meet the protesting nurses on the 4th of December, but the protests have continued, patients once again suffering.
Over 3,000 government nurses who are hired on a contractual basis are on a strike demanding permanent jobs and increase in their salary. However, there are about 12,000 nurses who are there on the payroll in the government hospitals, while there are 11,000 government nurses who are now on the contractual basis. There are about 3,000 nurses who are now involved in this strike, and this is also affecting the primary rural health centers. People here are saying that it is already the second day of protest, and if it continues, it is going to affect the patients. And thus, people here want the state health department officials and the nurses to resolve this issue amicably, as in the end, it will be patients who will suffer. In Chennai, Shweta for Media Now.
Time scale should be implemented. That is 191 GO should be implemented. For that, we are doing this protest from yesterday morning onwards. So here inside, more than 5,000 staff nurses are there. MRB staff nurses are there. So still now we are asking for our right. They are not ready to give, even though they are not no toilet facilities and anything. We are inside and we are doing our protest. The thing is, the time scale should be implemented. We are getting only 7,700 salary. Last 2 years, we have recruited 2015 onwards. So now 2017, those two years, only 7,700 we are getting. This is not even enough to fulfill our basic needs.
So actually we are getting rupees 7,700 per year. So the increment of 500 per year. That's all. So for that we are not able to do family works. If you are making them permanent, we will be getting 40,000, nearly 40,000, 6 times more than that. So for that only they are not doing the time scale pay. We are insisting on time scale pay.
The public will be inconvenienced. We are so dependent on the nurses as well, you know, as the doctors and the nurses as well. So if the government does not find a solution, it's going to be very bad for us.